record. And I'm going to go ahead and share my screen to get the study guide up. Okay. Can everybody see that?
Yes, ma'am.
Yes, ma'am.
Great.
Yes.
Okay, so I'm on the front page of it. We'll start with that. Chapters 22 through 24, 29 and 30, 6, 9, and 32. Number of questions 50, combination of multiple choice, select all that apply, and some math problems. 75 minutes. General questions.
Like Pro. It still has 3 cameras.
Pardon me? General questions to review for math, IV calculations, equivalents, conversions, oral and parenteral medication doses for kids. You should all have access to, for math resources, you should all have access to the calculations resource. Do you know what I'm talking about? Confidence with calculation. That should be in your student resources. It's an excellent resource. Case studies. You have case studies that go with each chapter. I'm not sure if your instructors are sharing those with you every week, but there are case studies that go with every chapter. With my group, I try and review them after we review the PowerPoint and the book for the lesson. We try and go through the case study as well. Obviously, levels of prevention, primary, secondary, tertiary, are important, or critical actually, to understanding the concepts of community health. Okay, we know that this is not an all-inclusive study guide. Helpful hints: review your case studies, especially the rationales. I am big on rationales. I like to review rationales. I review rationales when I meet with students after we do exam reviews, or when we do exam reviews, and go through, say, incorrect questions. I really hone in on the rationales for the incorrect questions, because I think that's an area for great learning. So review your case studies, review your readings and PowerPoints. Of course, the PowerPoints are an outline of what the chapter in the book covers. If you haven't attended class, review your Zoom weekly sessions, and then try and attend the review sessions. And if you can, at least listen to the recordings. Okay. I've broken out, I think this went out to everybody, but I've broken out at least to give you the weeks where the content was covered. So it assists you in going back if you need more understanding or more information. At least it's broken out by weeks. So let's start with this exam will cover weeks 3, 4, and 5. So let's start with content and information from week 3. So let's take a look at this first paragraph. Or everybody take a look at it. Wasn't everybody have a read, and then we'll talk about it. So read the first paragraph. So what do we think? What do we think this is about? What do you think that the content of this paragraph is about?
It's about the culture and for migrant workers.
Yeah, cultural sensitivity, cultural competence, absolutely. Right, being able to understand different cultures, different values and beliefs within that culture. This particular paragraph talks about the Mexican culture. Okay, gives specific cultural beliefs, cultural awareness, cultural norms for this particular group. Okay, so I would go back to there's a box in this chapter, and it goes through 4 different cultures. It goes through, I believe, African American, Asian American, Native American, and Hispanic. So you can go back and review that. That is in chapter, what chapter would this be? I think this would be chapter, was that? I don't have that piece of paper with me. It's in one of the chapters we covered in chapter 3, which is, I think 3 wasn't 3, 22, 23, and 24.
Yes, it was 23, 22 through 24. So it'll be in one of those chapters.
Yes. Okay. So go back. So this is about cultural competence, cultural sensitivity. So what kind of question might you get on the exam with regards to cultural competence for specific populations? What should we know?
You could get a question that's asking how you would respond to a particular patient regarding their culture.
Yeah. Or maybe it would ask, this is the current scenario, and this is the current information. What particular population is that from? Right? It could be a select, I mean, there's a lot of information in this paragraph. Could be a select all that apply. And be careful with those select all that apply questions, because it can be all. Okay. I did a lot of reviews for exam 1 in my 3 sections, a lot of reviews in the last 2 weeks. And one of the things that was really stuck out is students' assumptions about different questions. I never thought when you have an select all that apply question, it could be everything, or it could just be one thing, one answer. So be careful of those, and be careful, try when you read the questions, try and pick out those, we call them priority questions. Try and pick out the important words. Is it the greatest? Is it the least? Is it the first? Is it the last? There were many, many instances when I was reviewing with students that it was clear, and the students even said that was going on. They didn't read the full question. They read the question so fast that they didn't pick out what is the priority, right? What is the least helpful? So you've got to read the questions and try and pull out important either words or phrases. And I'm always an advocate for rereading the question a second time. Reading it at the speed that you do normally, but then taking a step back and reading it very slowly and pull out those words, because a lot of students got a lot of questions wrong on those priority questions. I'm just kind of going off here, but the other thing to focus on, this is just general information, is please know your Healthy People 2020 objectives. Okay, there were a lot of questions that were incorrect, and I realized exam 1, first exam, everybody's nervous, not sure how to study, not sure how the exam's going to look, not sure how the questions are asked. Well, now we're through that. Okay, this is exam 2. What's coming. You guys have got to understand Healthy People 2020 is a very important part of this class, of this term, of this community class. And in the book, every single chapter has a Healthy People 2020 specific box that outlines their objectives. Okay, when you get a Healthy People 2020 question on the exam, it's asking you about Healthy People 2020, not what sounds good. There were several questions in the last exam that in the rationale, it said, the answer is D, but A, B, and C are also important. They're just not Healthy People 2020 objectives. Does that make sense?
So would you recommend looking on the website for Healthy People 2020 for that, or would you recommend just looking through each chapter?
Just go into the book and make a little index card for each of the chapters for Healthy People 2020. There's no need to go to the website.
Okay.
I don't want you to overstudy and have too much information in your brain.
Yeah, that's why I asked. Thank you.
Yeah. And the other thing too is, and I've told my group for forever, these study guides are an excellent representation of the essential knowledge expected for you to know for the exam. I'm not saying to only use a study guide, but the study guide is a very good map, a very good outline of the concepts and the information covered on the exam. So the other thing is, don't overstudy. Don't feel like you have to go back to all the chapters we covered and know everything in the chapters from start to finish. You don't. Okay. This study guide outlines the important concepts from those chapters. Does that make sense? Trying to think of all the lessons I learned in the last 2 weeks or over the last terms with studying for exams. The other thing that is evident is most of the people I went with admitted they just go too fast. Okay. You get 75 minutes for this exam. Take your time. Try not rush through it. It's not a race to the finish. See who finishes first or second. Take your time. Okay. And then what else? What else did we come up with? Reread the question, take your time, and be mindful of changing answers. Overthinking and then changing. Please answer the question as the scenario is presented right now in the present as the question is asked, and not think of, oh, okay, well then, but what if in 6 months this happens? What would be the correct answer? No, take the current question in the current format and answer it for that. And then my last piece of advice is, when you go to take this exam, please take off all your other work hats, your EMT hats, your firefighter hats, your long-term care facility hats, your just put yourself in a community setting. Okay. Because things look different. Nursing process looks different in a community setting than it does, in other settings. And so just for the hour and a half that you take this exam, just try your hardest to put yourself in a community setting and not say, well, this is what we would do in the hospital, so we must do this in the community. No, not necessarily. Okay. So those are my little tidbits. Helpful? Too much information? What?
Helpful.
Very helpful. Thank you.
Yeah.
Very much appreciated.
Yeah, you're
Thank
welcome.
you.
Yeah, you're welcome. Those are just, and that's just real life experiences that I've had with students over the last 2 weeks. And I tell my students, it makes me absolutely crazy when Healthy People 2020 questions are incorrect, because you have all that information right in front of you in the book. Okay. And then, so we talk about Healthy People 2020, levels of prevention are extremely important, as is nursing process. You have to be able to take your nursing process, your ADPI, and apply it to the community or apply it to the topic we're covering. And we had some really good examples this week in the book of taking epidemiology and your or taking the nursing process and looking at it from the lens of epidemiology. And same with environmental health. We covered that this week too. You have to be able to take your nursing process is nursing process. You're always going to have your ADPI. How do you set up your nursing process in the community setting? What does it look like? Where you're talking about doing a nursing process in the hospital, maybe a single pediatric patient assessment, where in the community, you're doing the assessment of the whole family, right? So you have to be able to understand, not memorize, be able to understand how the nursing process is implemented in different settings. Okay. And with community health, we have a lot of different settings, right? We have the school settings, we have the hospice settings, we have the home health settings, we have the occupational health settings in the workplace, we have different populations in the communities. So we have lots of opportunities to apply our nursing process to different environments, different settings, different populations, different families, right? And then along those lines, you have to be able to take your levels of prevention, your primary, secondary, tertiary, and be able to apply those to all these different settings. You know, primary intervention in the hospital setting may look a lot different than a primary intervention in the community. You know, your primary intervention, let's take a diabetic patient in the hospital, may look a lot different than your primary or tertiary intervention in the community. So you have to be able to take primary, secondary, and tertiary and apply it to the setting and the topic and the concept you're covering. Okay. And community's big. I get it. Community nursing, community concepts, it's a huge umbrella, huge. But hopefully we try and, you know, not target, but we try and cover the important topics in each chapter that is essential knowledge for you to understand with regards to community nursing, public health nursing, community nursing. Okay, let's get back to the study guide. That was kind of a long mantra, but I'm just trying to help you guys out. It's a team effort, right? Team effort. Okay, so we're still on culture and migrant workers. Have a look at this paragraph that starts with the physical demands. Have a look at that, and then we'll talk about it. Okay, what's this question about?
Types of injuries?
Yeah, absolutely. Risks, the risks of working in these farms, in these agricultural settings for 12 to 14 hours a day, right? The risks, the actual injuries that may accompany those jobs, right? So the nurse assesses the client to see what's going on, what kind of pain it is, where it's coming from. Okay, so what kind of question might you get here?
Subjective question, like we ask subjective question to the patient.
Sure, that's a great idea. Yeah. Maybe assessment skills of how you're going to assess what kind of issue they're having, and what your plan is, what your nursing process is. Okay, great. What about this last one? Pesticide exposure. Start with that and have a look at that. So this is an important first sentence. There's a priority word in there. When you read the first sentence, what do you think?
There's a primary, like a level of prevention. It would be primary prevention teaching.
Yep. That's what I was thinking of. And hand washing. Yep. Necessity, that'll be the best way for prevention.
Yeah, absolutely. And you also have a statement. Pesticide exposure is the greatest, there's your priority word, right? Greatest health risk for migrant workers, right? So if you get a question about what kind of health risks are, I'm just throwing this out there, what kind of health risks are there for migrant and farm workers? And they give you a list of you know, pesticide exposures, injuries from machinery, whatever. And the questions asked, what is the greatest? Okay. Does that make sense? That's where a lot of students missed on the first exam. They were missing those words of greatest, least, biggest, first, last. And there's a good example of it. But also, how do we apply our primary, secondary, and tertiary? So what would be an example? You did the primary, right? Education. What would be secondary? What would be a secondary prevention level in this particular paragraph? What's secondary?
Oh, would that be like screenings for the illnesses that you can get from the pesticides?
Right, right. So a secondary intervention for this particular population would be, what kind of screening are you going to do for the employees or the workers to see if they do have any kind of levels of exposure? Okay. And then tertiary, I remember this from reviewing this in the book. Okay. Tertiary what would tertiary be? They're already showing signs of pesticide exposure, right? So now your focus is to decrease the complications or side effects, that they're having. So do you see how we incorporate primary, secondary, and tertiary into a pesticide exposure? If we know it's the great risk for migrant workers, then we should be able to articulate what a primary, secondary, and tertiary level of intervention would be. Right? Primary, we educate them on how to minimize their risk. Secondary, we screen them to see who's going to be at greatest risk and how do we work with them, right? And then tertiary is they're already showing signs of pesticide exposure. Now we have a whole different focus. Okay. So ATO, health, alcohol, tobacco, and other drugs. That's what that means. Okay. So have a look at this first paragraph. It's a big one. It covers a lot of information. A lot of information in this chapter. Okay. Or this paragraph. It covers how HIV is transmitted. And now we're talking about vulnerable populations, poverty, right? So it talks about HIV, how it's transmitted. It talks about homeless adolescents and gives you information about that. It talks about homeless teens, right? And it talks about STDs. Okay, a lot of information in that because the vulnerable populations we covered in week 3 were the mentally ill, the adolescent pregnancy, right? HIV and the homeless. Did I already say homeless? We know that poverty directly affects the health and well-being, right? In the following ways. Okay, and these are 5 good bullet points. We know that, and when we talk about poverty, this is the topic is poverty, but these are all the different populations that are at high risk for poverty: HIV, homeless, mentally ill. So we know that poverty, this is important here, poverty directly affects the health and well-being. All right. Higher rates of chronic illness, higher infant morbidity and mortality. You should have gone through this in your lectures. Shorter life expectancy, obviously more complex health problems, more significant complications and physical limitations, right? There come from chronic disease, right? Hospitalizations are definitely increased. right? So this is a good list of how does poverty directly affect health and well-being. Well, those 6 bullets are, I'd put those on a card, put those on an index card. Okay. So we know that the poor health outcomes are often secondary to barriers that impede access to healthcare, such as inability to pay for healthcare. This is still, we're talking about poverty. Okay, inability to access healthcare, lack of insurance, maybe language barriers, transportation, negative attitudes from healthcare providers towards clients, right? And access to healthcare is especially difficult for the working poor. Okay, so this is a good section right here on how poverty affects healthcare, right? Or affects health and well-being. Okay. And then we talk about alcohol, another one of the content areas we covered. So have a look at this paragraph here where it starts with alcohol. Okay, so I'm going to jump to the middle here first, and look at this. This is our role right here. To be effective, nurses need strong physical and psychosocial assessment skills. We need current knowledge of available, this is the nursing process, current knowledge of the available resources, ability to convey respect, dignity, value to each person. That was an important part of the lecture I did, was that we have to check our own beliefs and our own values at the door. We need to be able to convey respect, dignity, value of each person. One of the things we talked about in class is, you know, we all have feelings about homelessness or mentally ill. You know, if you're walking down the street and a homeless person asks you for money, depending on how many people we have in this class, there may be the same amount of different kind of reactions. But we need, as nurses, we need to be able to convey respect, dignity, and value for each person, irregardless of what our personal beliefs are. Right? We need to be able to work with that. That's what this whole section was about, is sensitivity, recognizing our own misgivings or shortcomings or our own feelings, and being able to care for these extremely vulnerable populations that we talk about. The mentally ill, the homeless, the HIV. So nurses need to be able to work with their clients to promote, maintain, and restore health, right? We have to be prepared to look at the whole picture, right? And in the community setting, the whole picture may include an individual. I'm still reading in here, the family. We may be looking at the individual themselves. We may be looking at the family as a unit, and we may be looking at the whole community, right? Assessment can take place in either the home or in a community site. And then we went through a whole section of visiting the home provides a great deal of useful information about family resources, support systems, right? And knowledge of their common housekeeping and health issues. We say that home visits are the best way to obtain information. You can do a physical assessment of the environment. You could do a social assessment. You can do an environmental assessment. You can do a risk assessment, behavior, violence assessment. Okay. And then the first part of this goes, it covers alcohol. right? And the risks and the adverse effects of alcohol and taking other kinds of drugs, right? You need to be aware of this because you know, you may be using this information in a primary, secondary, or tertiary level, right? So have a look at this alcohol section of this paragraph. Okay. And right here, nurses have a critical role in the delivery of healthcare to the poor, the homeless, the mentally ill, and other high-risk people. Okay, community health is, you're out there. You're out there. You're dealing with these populations all the time. Okay. Okay, this paragraph talks about, well, you can read it. When implementing population-specific health promotion, which is what? What's population-specific health promotion? Before you read this. Population-specific. A specific area of the population, right? So this gives you some lifestyle risk factors for certain parts of the population. Talks about college students, right? College students treatment and options for smoking cessation. So they're talking about if the nurse is having a discussion on lifestyle risk factors to specific populations. We talk about college students. We talk about the elderly, exercise classes, education, stress reduction techniques, right? And this sentence is just kind of written backwards. It's a priority for adults. So we talk about two different populations here. The college, right? And they identify smoking cessation would be appropriate for the college age kid when discussing lifestyle risk factors. And then they talk about the other risk factors for adult clients, environmental hazards, or priority for assessing for older adults. And then we have some information in this next paragraph about, this comes from the chapter, and we covered alcohol, tobacco, and other drugs. Right, again, some more essential knowledge. Right, it talks about alcohol being used in excessive amounts. It also talks about chronic alcoholism, chronic alcohol. It talks about marijuana. So this is you could pull out several definitions of this, right? Alcohol causes decreased B12 and folic acid. Chronic alcohol can cause confusion, malnourished state. And then you have marijuana, information about that, nicotine and caffeine. Okay. So again, good information about different types of drugs and what the risk factors are. And here they break out caffeine. You know, caffeine abuse through use of energy drinks can lead to cardiovascular complications. We need to know this as community nurses. Okay. And so this is good information about caffeine abuse. Okay. And then they specifically provide information on nicotine. Right. The oil used to deliver the nicotine contains high concentrations of nicotine and may be poisonous to the young child. So if you're counseling, right, if you're counseling, I think we talked about the when you're doing the environmental risk assessment in the home, and remember we talked about the family that has adults that smoke in the house. We brought up the example of if you're counseling the family about, you know, the goal is not having any smoking in the house. How do we counsel and educate the family? Okay, this is the kind of information we would be talking to the family about. Okay. Okay, and then you can read here about secondary. What is secondary prevention? Early identification, early intervention, right? And talks about maybe doing a behavioral risk survey to identify individuals at high risk for substance abuse. We do this in the high school setting, right? To try and identify these kids early who may be dabbling or maybe at risk, and try and get this identified early. We also do drug education in the primary schools, which is primary prevention, right? And then we know the tertiary is rehabilitation and counseling, right? Because they're already addicted. And then we also talk about risk factors for alcohol, tobacco, and other drugs. Why did it happen? What were the triggers? And we give lots of examples: childhood trauma, being a victim of violence, having a parent that has an addiction, history of mental issues. Okay. Okay, we're still in week 3. We're still talking about vulnerable populations. Let's talk here for a bit about mental health and illness. Have a read at this paragraph, and then we'll, oops, this one right here, responding to the feelings. So have a look at that for a minute. Okay, this is important information to know. Okay, this paragraph talks, the meaning of this paragraph is therapeutic communication. What is effective therapeutic communication? Okay. And what is non-therapeutic communication? Okay, this particular paragraph has a lot of excellent information in it about sources of stress, about Healthy People 2020 objectives, right? That are aimed at helping adults access treatment to decrease human and economic costs. So this right here is a particular Healthy People 2020 objective, right? And then we know that at some time or another, we're going to experience, everybody's going to experience a tragic, unexpected loss, setback, sadness, a time of profound sadness, grief, and distress, right? We as nurses need to be educated and have the experience of how do we therapeutically communicate with these people, these families, these communities. Has there been a natural disaster in the community? Has there been a death in the family? Okay. And then we have a whole section on teens and health. Okay. So now we're just breaking down each of these categories that we talk about, right? So we've gone through mental health and we've gone through poverty. So poverty, mental health, teens, and then the last one is the homelessness. Okay, so that's 4 vulnerable populations which we target in this class. And we know that teens are much more likely to experience violence during their pregnancies than adult women. Okay. And this talks about violence in pregnancies, increased risk for substance abuse, right? And important in this this paragraph is this: eliciting a history. Okay. You need to, during all of your prenatal visits with a pregnant teen, you need to be assessing what's going on, assessing for violence, assessing for abuse, because it's a common factor, right? The nurse must ask about violence at each visit. Okay, so how might you assess that when you're doing the questioning? What kind of questions might you ask a pregnant teen? If we know that it's a fact that teens are more likely to experience violence during their pregnancies than adult women, how are you going to assess that as the nurse? What are you going to ask? What are you going to try and get out of them?
Maybe ask how the father of the baby feels about the pregnancy.
Yep. Yep.
Do they feel safe?
How long the relationship has been.
Right. Right.
With them being as young as they possibly could be, as far as teens kind of gauge how the family feels as well, as far as the pregnancy.
Absolutely. Great point. Great point. And, you know, teens, yeah, maybe an open-ended question, you know, such as, you know, let them talk. How are things going? Well, that kind of opens it up for, oh, it's going really great, or it's not going well at all. But you have to be able to assess that here at every visit, if they're even coming to visits.
So
Right.
first we establish a trusting relationship with the patient and the nurse, and then we can ask them open-ended question.
Absolutely. That's exactly that's an excellent point. How do you establish trust with a frightened, panicked pregnant teen? You know, every situation's different, but you're right. That's what has to happen first. They have to be able to trust you before they're going to open up to you about what's going on. And then let's say they open up to you about what's going on, and there are bad things going on. What do you do with that information? What resources do you have for them? That's what a community nurse does. We have banks and banks of resources, referrals. You know, if they identify that it actually is a violent relationship and it is a violent time. Right? And then homelessness, right? And we talk about homelessness with rural communities. We're still in week 3, right? We all know this. People who are poor want to be treated like everybody else. Okay, it's important not to judge people who cannot pay their bills, right? There are many complex factors that may lead to the situation. Maybe temporary, maybe it's long-term, who knows, right? Maybe people who are unable to pay for their medications, they won't have been it. So how do you talk to people in this situation? You know, there's a good example in this paragraph. Will you be able to purchase your medication? Right? That's a yes or no question, right? It may enable them to seek assistance. And if they don't, it's important for you to know what resources, programs, help is in the community that may be able to assist with medication, food, and other necessities. Okay, homelessness it's a very complex community health issue. Okay, but you know, people want to be treated like everybody else. Okay. So, in rural communities, let's do some information statistics about rural communities, right? We know it's fact that rural communities have an overall decrease in health status when compared to urban clients. Why is that?
Access to healthcare.
Access, one reason. Yep. What was that?
I said the same thing he did, just
Yep.
access to care.
Access. Yep. Yep. What else?
Willingness to participate.
Absolutely.
I was also thinking transportation as well.
Transportation is a big barrier in rural health, right?
Could you also include like the amount of staff available in healthcare in a rural community?
Yeah, like the specialty. I mean, there's no specialty services in rural communities. It's usually general practitioners. And the same doctor may be covering a couple of different communities, and he may be the delivery doctor for a baby, maybe the pediatrician, he may be caring for everybody in your family. Okay. And what's the other things? Oh, that comes up in the next paragraph. Rural clients are less likely to participate in activities during leisure time. Decreased compliance with safety precautions, such as wearing a seatbelt. Do not engage in preventative health screenings. And then we know, excuse me, chronic disease is more prevalent among rural clients. Why is that? Because they're less likely to seek care early on.
Yeah, because they don't have any mean of transportation to go to see the doctors, and then they just keep their disease, and at the end, they're end up having like big health issues.
Exactly. Exactly. And what happens when you have decreased compliance with safety precautions, such as wearing a seatbelt? We have accidents, right? Injuries, intentional, unintentional injuries, farm equipment. They do not engage in preventative health screenings, which is exactly what you just said. If you don't engage in preventative health screenings, then you're going to end up, if you're ill, with chronic diseases that are more prevalent. And then this next one we talked about in class, clients who live in rural communities know each other, very familiar with each other. Everybody knows everybody. There's a lack of anonymity among rural communities, which makes reporting health issues a challenge, right? Clients are far less likely to report sexual assault, drug use, depression, right? They're worried that everybody's going to find out. Right, so that's important. That's an important fact about rural communities. All right, and then we talk about resources for our older adults that live in rural communities. Right, lots of barriers. Okay, transportation is the #1 barrier for older adults living in rural communities. Okay. All right. Questions so far? Is this review okay for you, going through it like this? Is there other things you want me to add in here, or how we doing? Just doing a check-in.
No, I think we're doing pretty good. I think we're going through everything pretty well. So
does everybody feel like that? Or
I do, yes.
Yes, ma'am.
okay.
Yes, it's very helpful.
Okay, great.
Yes, ma'am.
Yeah.
Great. Super. So let's talk about primary and secondary. Okay. So this talks about the most effective evaluation would be to measure, this is a scenario, measure your A1C 6 months after beginning the program to demonstrate that the behavior is actually changing. Okay. Survey obtaining. So this is talking about, this isn't primary, this is secondary. Okay, so this would be secondary because you have done early intervention. This is just giving you an example of secondary, right? So you have identified who's at risk. You have made some changes, right, into how we're going to measure the A1C. And then 6 months later, we're going to actually check it out to see if the changes are improving. Okay. And so this also talks about, how do we teach? This is a teaching question as well. You know, how do we have clients do return demonstrations, right? And why do we have clients do return demonstrations when we teach them, right? Because we want to make sure they understood what is being taught. Okay, we want to make sure that they're using that information to continue to improve in their daily life. Right, so this is still secondary. A survey obtaining feedback can improve nurses' delivery. Okay, so feedback or survey is secondary, right? Screening, you can do a survey, you can do a phone call, you can do a mail out, you can do however you're going to gather information about the screening, right? And then a focus on primary prevention is preventing the problem before it even occurs, such as a walking group for health seniors. Okay, blood pressure screening we know would be secondary. And then support groups and counseling of individuals with existing problems is considered tertiary. All right, so again, a few more examples of primary, secondary, and tertiary. You have to be able to apply your interventions to different concepts and different topics. And then we talk about quality improvement activities, right? I mean, we think of the hospital, we're always talking quality improvement, continuous quality improvement in the hospital setting, but quality improvement is just as important in the community setting, right? We know the quality improvement activities are a crucial part of any kind of nursing care delivery, including the community setting. Okay. You can go through these: monitoring care, seeing and analyzing opportunities to improve care. Think of your nursing process right here. So let's apply our nursing process to quality improvement, monitoring care, seeing and analyzing opportunities for improving care, developing guidelines to improve care, collecting data, making recommendations, implementing your recommendations, and evaluating. Okay, so if you're involved in the quality improvement process, once you do go through that nursing process, the results of your activities are hopefully used to make changes in healthcare delivery. Okay, clinical data is of great importance in assessing the quality of care. Right, documentation is critical. Right, and then we talk about increasingly the documentation occurs in health, and we're doing electronic health records, right? And as nurses, we're always trying to identify ways to improve quality care. Okay. So quality care is important to, if you need more information on that, go back to the chapter that talks about that. But this is applying quality improvement monitoring to your nursing process. That's what this is about right here. Okay, and again, I said at the beginning, you have to be able to apply your nursing process to all these different topics. Okay, in this here we talk about epidemiology and what's the epidemiological triangle?
Agent, host, and environment.
Okay, what's an agent?
That is a disease.
Yeah, agent is whatever the infection disease is. What's the host?
The host will be us.
Exactly right. And since it's hard to predict the environment, which is the third prong of this triangle, it depends on what's going on in the environment, right? Of how agent and host are going to interact. What's going on in the environment. Okay, so epidemiologists understand that disease results from complex relationships among causal agents. What is that? I don't know if we talk about what is complex relationships among causal agents. Do you guys remember what that's the definition of? Remember, that's the web of causality, right? So the web is simply a web, that there are so many factors that could affect the agent, host, and environment. It's a complex web, and that's what the web of causality is. right? It's whatever the complex relationships between the agent, host, and environment. And there's gazillions, depending on what the agent is, depending on, you know, who the host is. Is the host compromised? Is the host healthy? Is the host young, old, more at risk? Is the agent minimal? Is it the, you know, minor flu? Is it big? Is it COVID? And what's the environment? Is it the community setting? Is it a long-term care setting? Is it a hospital setting? Right? So changes to any of these elements can influence the occurrence of the disease, right? Decreasing a person's risk, increasing a person's risk. It depends. It depends what the agent is, who the host is. If you're already a very impacted person and have a lot of comorbidities, and COVID, you get COVID, you're going to be more at risk for being sicker than the young, healthy athlete, right? Associations between risk and causality, morbidity and disease do not demonstrate the relationship to the development of the flu. Okay, so again, this is all about the triangle. Okay, the triangle has many different many different ways it presents itself. Okay, and we just need to be able to understand how each of these may affect each other. There's a really good box in the book, in this chapter, Epidemiology. Is that chapter, we covered it this past week, so I think that was chapter 9, right? There's a really good box in this book, in your book, that gives you examples of what is an agent, what could be a host, and what could be factors in the environment. I suggest you go back and look at that. And if anybody's in the book now, they can go into chapter 9 and find where that is and let the rest of us know where that
Page
box is.
139.
There you go. What is it? Page 139?
Yes, 139.
Yeah. So I would encourage you to go back and have a look at page 139 in that box that talks about the agent, host, and environment. Okay. And then this next paragraph talks about chapter 6, which is environmental health, and how do we do what are environmental health risks? And for anybody in my class, where did we read it? Where did we see this?
In the workplace.
No, where did we review this? We reviewed this in class this week. It is in your case study, question 1. It's the rationale. Okay. So this comes from our case study. And that's why I think it's important to review case studies as well as PowerPoints, because case studies and rationales provide a wonderful additional information, right? So we know as nurses that we're one of the most trusted sources of health information to the public. And so it's our responsibility to know about environmental health risks. This is chapter 6. How do we know how to assess them? How do we know how to eliminate or reduce them? Communicate, educate, advocate for policies to support a healthier environment. Okay, here, I want you to know these. Here's 10 principles that compromise the nurse's responsibility in environmental health. And it goes through what these 10 principles are. Okay, go through the first couple. You must know about environmental health. You yourself should not be using products or practices that harm the health or environment, right? We have the right to work in a safe and healthy place, right? We have a right to know in a timely manner about possible harmful products, chemicals, pollutants, hazards, which we may be exposed to. And here's where we tied in occupational health, right? everybody that works in hospitals, clinics, whatever, what do you think about? Remember that, your MSDS sheets, right? Your safety, your environmental sheets of what's in the workplace, what are chemicals, what's in the workplace, where is it located, where is it stored in case of a emergency. We have to know our environment and the health risks that are within it. So have a look at this. And if you want to review, I would suggest you review the case study. Review the case study for chapter 6. It's an environmental risk question. And if I can remember correctly, I believe this is the rationale for the first question. Any of my students can pull up their case study and confirm that, because you all have it. Okay. And then we talked about faith. This was all in 1 week. Faith nursing, hospice nursing, home health nursing. Okay, these are three additional areas of community health and the roles that nurses might have in community health. You could be a faith-based nurse. It's also used in the book. It's called parish nursing, faith nursing, parish nursing, interchangeable. The hospice nurse, the home health nurse. We already covered the school nurse prior. We have the occupational nurse. I mean, lots of different roles we can play. Right? So this first paragraph, nurse should recognize when the family of a client who's actively dying requires support. Right? This is some information about hospice nursing. Right? Encourage the family members to discuss their concerns. Every situation is different. You may have very engaged family members. You may have very distant family members that don't want to be engaged, right? During the dying process, the nurse should encourage the client's family to be present, right? However, if a family member voices concerns, the nurse should be able to support that family member in trying to work with them. So that's from hospice nursing. Right? The goal is that in hospice nursing, we want clients' family to be present. That's the goal. And so how does that hospice nurse work with the family member who is not engaged? Right? And then this is really important. Listening attentively to a client and encouraging the client to talk is an appropriate response. I went through a scenario with a family member a while back with a hospice nurse. She was the best listener as a nurse I've ever been around. She had the family, and I'm from a huge family. Everything would not have gone as smoothly as it did without this particular hospice nurse. And one of the things that I noticed immediately when she started working with our family was her listening skills. It was amazing. Okay. And then for a home health nurse, a couple of things that they need to know is the difference between Medicare and Medicaid. Okay. And there's an excellent box in your chapter. The home health, that's probably, let's see what chapter that was back in. That might be chapter 24. There's an excellent, whatever home health hospice chapter. Okay.
For the week 4 content, the chapters was 29 and 30. Okay.
So it's either 29 or 30. Okay. I think faith-based is 29 and hospice and home health is 30. So I think it's in chapter 30. There's an excellent box that breaks down the difference between Medicare and Medicaid. Okay.
I had a quick question.
Sure.
When you were talking about hospice nurses and hospice care, you said the goal was to have family a part of that hospice care. Like a big goal is to have the family a part of that.
Engaged, yes.
Okay. I just wanted to make sure.
Yes, that's the goal. Right up here. During the dying process, the nurse should encourage the family members to be present. But You will have family members that are not engaged or voice concerns. And the nurse, as a hospice nurse, should be able, the expectation is that they should be able to support all family members and maybe explore the feelings of family members who aren't engaged. And that was my example of listening attentively. We had family members in our family that were not engaged. And she finally got everybody engaged. And the way she did it was incredible. So back to home health, please go into chapter 30 and look at your box of differences between Medicare and Medicaid. It's really important for home health nurses to be aware of that. We know that there are two major federally supported programs for home health, right? And this gives you a little bit of a understanding of the differences. Medicare is for the older clients or the disabled or the homebound. Okay. And we know that Medicaid is income-based. Okay. Covers maintenance programs and it's set by the state. So yes, they're both federally funded programs, but Medicaid is operated by each state. Okay. So an example, when I'm in school nursing, Medicaid, since it's income-based, we try and refer as many families as we can that don't have insurance to see if they are eligible for Medicaid. Okay, it's income-based. Where Medicare is for your older adults, you're disabled, your homebound status. Okay. So, home health nurses. Okay, home health nurses should be able to assess the environment and identify potential risks to the client. That's right. So I said back earlier that home health visits are awesome. You can do so much assessing and identifying of risk factors. All right. So when you're doing your environmental assessment in the home, what kinds of things, potential risks might you see? Right? Here's a couple of examples. A refrigerator with a temperature control not working. Obviously, that's a risk, right? For contaminated food. Non-skid mats in the bathroom can prevent falling from a shower or tub, right? Carbon monoxide detectors can prevent carbon dioxide poisoning, right? And then prescribed medications should be stored in the original pharmacy bottles. Okay, what kind of question might you get with regards to this information?
Get like a select
Private
all,
question.
Yeah,
and probably it'd be like a education point
yeah,
on what these patients should look for, what the health nurse should look for upon a home health visit.
exactly. You know, or yes, in addition, maybe what of the following are environment or risk factors in a home, right? Or what of the following could we use as primary prevention, or would be a primary prevention intervention, or a secondary or a tertiary? Okay. And then this is regard the next three paragraphs are faith community nursing, right? We talked about the difference between spirituality and religiosity. Please know the difference between the two of them. Spirituality refers to the attitudes and beliefs related to the transcendence of non-material forces. So that's the big picture. Spirituality is the big picture. Okay, religiosity refers to behaviors, beliefs of a certain religion. Okay, and when we talk about faith community nursing, that is a particular faith in a particular place. Could be a mosque, it could be a church, it could be a synagogue. Okay. And then there's two types of models for parish nursing, the congregation-based model and the institutional. Okay. Do we know the difference between those? What's the difference between those two? So in a congregation-based model, right, you're autonomous, right? You're working simply with the congregation, right? You've worked with the health ministries to determine what the goals of the nurse should be within the congregation. All right. Are they going to be coordinating meals, facilitating support groups, grief counseling, visiting new parents that have just had new babies? What is the role? The role is going to be congregation based. Okay. However, if the congregation requires more health support, which they often do, then the leadership of the congregation has to decide what services they want to collaborate with other agencies to get those services into their congregation. And that's when it becomes the institutional based model. So what that means is, let's say in the congregation based model, the faith-based nurse is doing what we just talked about: coordinating meals, facilitating support groups, establishing childcare services. Well, if they decide they want to participate in the healthcare, say for stroke patients in their congregation, they're going to need physical therapy, occupational therapy. Then the institutional base simply means that they're going to collaborate out in the community, work with medical care facilities, hospitals, collaborate with them to provide those services. Does that make sense? So then it becomes an outreach of the congregation, which is the institutional based model. Okay. And then this is some information about faith community nursing. When visiting a client who is a new mother, what are the priorities? The priority of the nurse is to assess the parent and infant bonding, reinforce holistic reflection of life transitions, and plan for faith community support. Okay. So that's important to know what the focus of the faith community nurse will be. Okay, still in week 5, we're back to epidemiology. All right, what is epidemiology? Epidemiology studies report the distribution of a health event within a population by investigating the proportions, risks, and rate. And then it goes through what is. You need to know what a proportion, risk, and rate is. Right, and it goes through what each of these are. Okay. The risk measures the probability that the health event will occur. The proportion determines the number required to measure the incidences within a population. And then the rate is the frequency of the health event that occurs in the population. Right? So for those of you in the book, somebody go to chapter 9 and find me the box that we reviewed about how you calculate these rates, the mortality rate, let's say it gives you specific ones here: cause specific mortality rate. Okay. Crude death rate. Okay. There's a box to review of how to calculate all these rates and proportions. Okay. And there's simply number of deaths over the total population or infant deaths over total population gives you an infant mortality rate. So if anybody, it's in chapter 9. So the box I think is titled Rates, Proportions, and Risk. And then here we again focus on the epidemiological triangle. Right, the agent is the factor that must be present for the disease to occur, such as bacteria. The host is the living species capable of being infected, which is us. Right, and the characteristics of us that promote disease occurrence definitely include what our immunological status is. Are we healthy? Are we compromised? And then the environment is the internal or external factor that influences the disease. Right, so the environment affects how the agent and host are gonna interact. Get real sick or not get real sick. Okay. And then if the nurse is involved in epidemiological studies within the community, right? When discussing an epidemiological study for the first time, the ecologic design is the best use, right? And here's the difference, a few differences and a few methods. The ecologic study is quick, easy, and uses available data. And then it talks about a few more, the cross-sectional, case control, and prospective cohort requires time and collaboration and interpretive data. So that's just some different methods. There's also in chapter 9, there's a box that outlines these 4 different methods, epidemiological methods. Okay. But if we're looking for we're doing a first time study and we want to do a quick and use the data that's readily available, it would be the ecologic design. And then there's examples of when you would use your cross-sectional, your case control, and your prospective cohort designs. Okay. How are we doing on? Are we getting close? You guys doing okay?
Yep.
Yeah.
Yes, ma'am.
I lost my place. Okay, environmental health risk factors. Environmental health risks are factors that can cause disease or injury from exposures. Okay, exposures in the community can happen in home, work, church, rec center, right? So we need to be able to accurately assess environmental risks of where they occur, right? Risks are unintentional poisonings, such as mercury from fish or lead from paint. These are environmental risk factors. Okay. Healthy People 2020. Okay. Healthy People 2020 is they have environmental health objectives that would benefit migrant workers. What would those be? Reduce pesticide exposure that results in the need for healthcare. Right? A mobile clinic tracking system, screening clinic focused on objectives that prevent disease. So if you're asked about what are some environmental health objectives with healthy people, go into chapter 6 and go to the Healthy People 2020 box. This is a summary of that box. Okay, again, on chapter 6 here, when assessing environmental risks, the nurse should evaluate for issues causing unintentional accidents or injuries, such as poisonings, right? We know that older homes have a higher risk of paint containing lead, which potentially could cause damage to developing children. So some thoughts: gate around the pool, an alarm on the door, security cameras, or appropriate safety initiatives. So what do you think you might get asked with regards to this? Or what kind of question?
You could get a question that asks the nurse which factor requires the nurse to take action first, or
Sure,
something like that.
sure.
Another priority question, like a priority intervention question, teaching questions.
Yep.
Select
You
all
go-
that apply.
Yep, you go to do an environmental risk assessment in the home. Which of the following would be of concern that you need to talk to parents about? You know, maybe no gate around the pool, no alarm on the door, right? Okay, some occupations, this is I believe an occupational nurse question. Some occupations have risk factors for developing pardon me, respiratory conditions. So the occupations with the highest risk factor include coal miners, glass makers, and construction workers, right? Why? They have a higher risk of breathing in particles that can cause diseases such as I can't pronounce the word, and silicosis. Clients who work in an office building, on a farm, and with animals could have risk factors for developing allergy and asthma. Okay, not the occupational disease. Okay, so this is big. We need to be able to identify, as the community nurse, what are some occupations that have a higher risk for respiratory conditions. In our occupational chapter, which I believe is 32, occupational health chapter, there is a box in chapter 32 that talks about specific occupations, what they're, the left section is the left column is the occupation, the middle column is what they're exposed to, and then the right column is what potential infectious diseases or conditions or illnesses might that cause, short-term, long-term. Okay. Okay, so it's right here. So that's the last part, is our occupational. Okay, so we know that trends in occupational health have seen a major increase in hazards related to, and here's a list of some trends that have caused increase in hazards. Burnout, nanotechnology, non-ergonomic workstations, complex chemicals, exhaustion, right? We know that these hazards, all these hazards are increasing the risk of injury to workers. Right. And let's talk about physical hazards. When assessing for physical hazards, what are physical hazards? Right? Things that cause, say, tissue trauma, such as noise levels, extreme temperatures. The environment's hot, the environment's cold, the noise levels. Right? Lifting devices. Right? There's a lot of lifting injuries in the work setting. Okay. There's a good box in this chapter that talks about the 5 different hazards. Okay, physical, mechanical, environmental, chemical, biological, and infectious hazards. Okay, have a look at that box. It gives you examples of each. Really good. That's a really good box of information of breaking down what the types of hazards are in the workplace. I believe there's 5, and this paragraph here just summarizes it. Okay, and then again, in the workplace issues, transmission of TB is a major health care problem. Right, I'm talking in the workplace now, or prisons, correctional facilities. TB is a major health problem. It's often spread in workplaces with close quarters, such as hospitals and correction facilities. Right? So if you're a nurse and you work in the correction systems, okay, this is something we need to be mindful of. Okay. And then again, we go back to some levels of prevention. Okay, so tertiary level of prevention focuses on minimizing complications and reducing the number of missed work days. So we're applying tertiary intervention into the occupational setting, which is the workplace. Right, so our tertiary level of prevention focuses on minimizing complications and reducing the number of work days. So if there's an increase in absenteeism amongst the group of workers who has diabetes, this is what this example is, right? So maybe the occupational health nurse would implement an education program on glucose monitoring. Okay, so that this particular group, the tertiary level, the goal is to minimize complications and reduce the number of missed work days. Okay, that's what the occupational health nurse does. She does assessments of workers and what the risks are, and then certainly the workplace. What are the hazards within the workplace? Okay. Providing safety equipment, scheduling routine breaks, right? Those are all primary levels of prevention. Okay. And then the two organizations that you need to know about that directly impact occupational health are OSHA and NEOSH. Okay. And the function of both of them, the function of NEOSH is to conduct research, identify health and safety hazards, and then distribute the research. Right. And then OSHA, their goal or their role is to enforce the standards, right? Maintain database, establish exposure levels. So NEOSH is kind of the big picture. They conduct the research, they identify the hazards, right? And then they distribute it. And then OSHA enforces what's been set up as, you know, who has been part of an OSHA visit in your facility? It's a big deal. It's a big deal. Okay. They're enforcing the standards that have been set up for your organization. Okay. So that's the study guide.
Professor, what NIOSH stand for?
National Institute of Occupational Safety and Health. There's a box in chapter 32 that talks about the difference between these two. Okay.
Thank you.
You're welcome. Helpful, not helpful, more confusing, more, how are we feeling?
I
I feel like it was helpful.
helpful.
Yeah, I
Yeah.
think it's good to just talk about it and discuss it.
Yeah, yeah,
Thank you.
yeah. You guys have any questions? Again, go back to your, if you need more information, go back to your chapters and look at these boxes. These boxes in your chapters are excellent summaries of these topics we're covering in the study guide. And you should all
That's my point.
you should all be familiar when you go through your study guide. Everything we just covered should be a review, right? You should have heard this information. You should have studied this information. You should have learned about these topics and concepts in the last couple of weeks, right? So the study guide is simply meant to be a review, right?
And then this study guide is golden. Like if we get a study guide like this for other classes, it'll be very helpful too. Like there's on point, everything is so clear. And then all professors are very helpful to clear everything out. I really appreciate all the team.
Yes,
Great.
I
Yeah.
totally agree.
Yeah, we worked hard on these study guides. We did. We really tried to make them a good reflection of what the expected essential knowledge was. Because community health, as I've told my class, and I always tell my class, is big. It's huge. It's a huge part of nursing. And sometimes we get so focused of, we get so tunnel visioned about thinking about, our patients in the hospital. What happens when our patients in the hospital go home? That's community health nursing. Lots. It's community health is huge, right? You're working through all the lifespan. You could be working with infants, you could be working with disabled children, disabled adults, you could be working with the chronically elderly, you could be working long-term care, group homes, substance abuse.
I was just looking through the book because you mentioned the Healthy People 2020 objectives.
Mhm.
And for chapter 32, I believe, for anyone that uses the book, the Healthy People 2020 box is on page 574.
Awesome.
So
Thank
if you
you,
want to look
Daniel.
through those
Thank you.
objectives, no problem.
Yeah. Yeah. I mean, it's team approach. Everybody's helping everybody. I want everybody to be successful in this class. Okay. I try and do my part and you've got to do your part. Okay. But team approach, whatever I can do to help anybody, whether you're my students or not my students, whatever I can do to help you all succeed in this class and hopefully providing a decent review. That's what I'm here for. So has everybody put their names and campus and instructors in the chat? If you haven't, please do that now so that, because I have to copy and paste this and let our other instructors know who attended. And so I'll stay on if anybody has any review questions, and I'll stay on even way extra if somebody can help me with the YouTube recording stuff. Because I don't know, I don't have any.
Thank you
kids
so
around.
much.
You're
Thank
welcome.
you.
You're welcome.
Thank you.
You're welcome.
Thank you. Enjoy the rest of your day.
Yeah, you too. Happy Sunday.
Thanks.
You're welcome.
Thank you.
You're welcome.